Understanding sex addiction, causes, effects and how to overcome it. Hi, I'm Dr. Tony Weston. Today we're diving into a topic that is often misunderstood, stigmatised and rarely discussed openly, sex addiction. What exactly is sex addiction and how does it affect those who struggle with it? We'll explore the psychological and emotional roots of this compulsive behaviour, what it is and isn't, and most importantly, how you can overcome it. So firstly, understanding sex addiction. Sex addiction, also known as compulsive sexual behaviour, is not just about having a high libido or enjoying sex frequently. It's characterised by an overpowering preoccupation with sexual thoughts, urges, or activities that feel out of control and start to negatively impact our daily life, relationships and responsibilities. It's when sex becomes a way to cope with emotions, escape reality or numb psychological pain, rather than being a healthy expression of intimacy and connection. What sex addiction is not. It's essential to distinguish sex addiction from normal, healthy sexual behaviour. Sex addiction is not about having a high sex drive or being sexually adventurous. It's not about having multiple partners or engaging in consensual non-monogamous relationships. Sex addiction is when sexual behaviour becomes compulsive, meaning you feel driven to engage in it, even when it causes harm to your life. It's when you use sex to avoid or soothe emotional pain, rather than seeking genuine connection or pleasure. Some of the psychological and emotional causes. Sex addiction doesn't develop in a vacuum. It's often rooted in deeper psychological and emotional issues that drive compulsive behaviours. Let's break down some common causes. Firstly, trauma and abuse. Many people struggling with sex addiction have experienced past trauma, including sexual abuse, neglect or emotional abandonment. Sexual behaviour becomes a way to numb or escape from the pain of those experiences. Secondly, emotional regulation issues. Sex addiction often functions as an unhealthy coping mechanism to manage overwhelming emotions like anxiety, depression, loneliness or stress. It becomes a quick fix that temporarily soothes emotional turmoil but ultimately exacerbates the underlying issues. Thirdly, attachment disorders. Unresolved attachment issues from childhood, such as having emotionally unavailable or inconsistent caregivers, can lead to seeking comfort and validation through sexual encounters rather than healthy relationships. Fourthly, low self-esteem and shame. Feelings of low self-worth, inadequacy or shame can drive compulsive sexual behaviour as a way to momentarily feel desired, powerful or validated. However, this relief is fleeting, often followed by guilt or more shame, creating a destructive cycle. Here are some of the effects of sex addiction. Sex addiction can have profound effects on every aspect of life, not just for the individual but also for those around them. Firstly, relationship strain. It often leads to broken trust, damaged relationships and deep emotional pain. Partners of those struggling with sex addiction may feel betrayed, neglected or deeply hurt. Secondly, mental health impact. People dealing with sex addiction often experience intense feelings of guilt, shame, depression and anxiety. The secrecy and self-loathing associated with compulsive sexual behaviour can make mental health issues worse. 3. Professional and financial consequences. Sex addiction can result in significant financial costs, legal problems, job loss or other professional consequences. 4. Risky sexual behaviour such as infidelity or engaging with sex workers can lead to public scandals or legal trouble. How to overcome sex addiction. Overcoming sex addiction is challenging, but it's entirely possible with the right approach, support and mindset. Let's look at some steps that can help. 1. Seek professional help. Therapy is a crucial step. Therapy can address the root causes of the behaviour and help develop healthier coping mechanisms. 2. Identify your triggers. Understanding what triggers your compulsive behaviour is vital. Is it stress, loneliness, or specific situations? Identifying triggers helps you anticipate and manage them effectively. 3. Develop healthy coping mechanisms. Replace unhealthy behaviours with positive alternatives. Exercise, meditation, creative outlets, or building supportive social connections can help you manage emotions without resorting to sexual behaviour. 4. Build a support network. Join support groups such as Sex Addicts Anonymous or connect with trusted friends and family. A strong support system can provide encouragement, accountability, and a sense of community. 5. Set clear boundaries. Creating boundaries with access to trigger environments such as limiting internet usage or avoiding certain social situations can help reduce the temptation to relapse. 6. Practice self-compassion. Be kind to yourself throughout the recovery process. Sex addiction is not a reflection of your character or worth. It's a behaviour driven by deeper issues, and overcoming it takes time, effort, patience, and courage. Sex addiction doesn't define you, and it doesn't have to control your life. With understanding, therapy, and support, you can break the cycle and find healthier ways to cope with the emotional pain that drives compulsive behaviour. Thank you for joining me today. If you or someone you know is struggling with sex addiction, remember help is available and you're not alone. Please share this video if you found it helpful and subscribe for more insights on mental and emotional health. Until next time, take care of yourself.